And our topic today is shifting transitional housing programs to rapid rehousing. Before I talk about the agenda, let me talk about some of the logistics for today. First off, we are scheduled to go till noon. We may or may not use all that time. There's plenty of time for you to ask questions and for us to have some dialogue, but it depends on how many questions you have if we end up going all the way till noon. This webinar is muted, so you can hear us, but we cannot hear you. You do have the ability to ask questions, and you can ask questions at any point throughout the webinar. We'll be answering questions towards the end, but as you have questions, do feel free to type into the box that you should see on the right side of your screen. If there are questions that go unanswered, we will either email you the answers or put the answers on our website or put them in blog posts that the Alliance does. This webinar is also being recorded, so you can find the recording if you want to hear it again or if you want anyone you work with to hear it. That will be available on the VCEH website in a few days to a week. Now let's talk a little bit about what we plan to accomplish on today's webinar. There's been so much focus in homelessness on shifting programs to ensure that the programs that we're running are achieving the best outcomes that they can and are helping people experiencing homelessness access and maintain housing. And as part of that larger dialogue, there has been much discussion regarding what's the role of transitional housing and how can we all ensure that transitional housing programs are the most effective and are part of the community's response to homelessness that's very focused on accessing housing and maintaining housing stability. Therefore, today's webinar is going to cover a variety of issues related to the role of transitional housing, why you might consider shifting your program, how, and we're also going to hear from a service provider on the process that her agency went through to retool their transitional housing programs. We have a variety of folks on the call today. When you registered for the call, you were asked to tell us your readiness to transition your programs. And the responses we received really fall along the whole continuum of folks that are very, very ready and want some information on how to make it happen to folks that still need more information to identify what would be best for their agency and for their community. So to address everyone's questions, we're going to start with why. So for those of you that haven't talked about this as much, and for those of you that don't have as much information on the reasons why you might do this, we're going to start with that and then continue and get much more technical towards the end of the webinar. There are probably going to be questions that we can't answer, particularly as it pertains to how you can use HUD funds to transition your programs, and we'll just indicate where we can't answer those questions and where your best bet would be to directly contact HUD through the HUD HRE website. And again, if there are questions that we either don't get to or we can't answer, we will identify a mechanism to get you that information as we do develop the answers and figure out the answers to those questions. So without further ado, I'm going to pass it to Moshier McDivitt, who is the Capacity Building Associate with the National Alliance to End Homelessness, who's going to walk us through why you might consider retooling, and then talk about some strategies to retool. And after Kay, Ross Altenbaugh with Hilliard House in Richmond, Virginia, is going to share with us the process that her agency went through and offer us some concrete things that she did as she went through the process. So I'm going to pass it to Kay.
Thanks, Phyllis, and welcome everyone. I'm happy to be here on this call. So I'm going to reiterate a little bit what Phyllis just said, that again, we're aware that folks are at different points in the process of considering retooling transitional housing to a rapid rehousing model. Some of you are just starting to think about it, and so you're looking just for some additional information on ways to think a little deeper about it. Some of you are ready to do something, but maybe you're not sure where to start, and we know that a number of you have actually started the process and are looking for some additional direction and assistance in the details. So again, we're going to go through a lot of areas in this, and so we think that we can provide information on this webinar that's going to be able to address all of those levels for retooling your program. So I'm going to start out by talking about what we do know. So at the Alliance, we've been hearing from a lot of providers and communities who have really looked at their transitional housing resources and have started successfully retooling programs, and they've had some significant results. Some of the results they've seen have included increased access to permanent housing, shortened length of stay, which then really significantly increases their capacity to serve more families. In some communities, while family homeless numbers throughout the year rose, they in fact didn't need to increase any capacity in the crisis system, because as you start increasing capacity in your transitional housing program by moving people through more quickly, moving to rapid rehousing models, increasing rapid rehousing resources, people then are moving through the system more quickly, and that when people are moving out of emergency shelter beds within the first 30 to 45 days, that quick flow of people out of the shelter system then really allows those beds to be available for the next people that are experiencing a housing crisis. So it's really important for communities and providers to think about how they can contribute to that. And the other thing we've done at the Alliance is we've conducted our performance improvement clinics in various communities across the country. And when we do that, we use all their local data to do cost comparisons for permanent housing exits from different systems. And this data has really helped those communities begin the process of repurposing transitional housing resources to more efficient strategies. And then we continue to get a lot of requests from communities that are looking for ways to make the most effective use of their resources, and from providers who are really looking at what they have and wanting to start rethinking and retooling their programs. So the Alliance, as a result, is creating a toolkit that's going to be helping providers. It's going to include things like a decision matrix, retooling checklists, and then some community examples. We hope to be able to publish that in the next couple of months. But today on this call, I'm going to be reviewing some of those things that we'll be including in that toolkit. So we've also learned a lot about transitional housing, length of stays, and outcomes. And what we found is that transitional housing really varies a lot from community to community. In some cases, the length of stay is only 4 months, but there's still a lot of programs that have 1 to 2 year lengths of stays. And what we've discovered is that the programs with shorter stays then obviously allow them to serve more households in more cost-effective ways. And then other programs that have the longer year stays end up really sometimes creating a backlog in the homeless system, and they can cost a lot more due to those long stays. We also know that in a lot of communities, people will enter transitional housing from other programs, emergency shelter or other transitional housing programs. In some cases, we know that folks that are shelter hop or go from one program to another. And what that ends up doing is really adding to the length of stay in communities, and it just ends up, again, creating a lot of backlog for those new families that are having crises. And we also know that across the country, about 1/3 of transitional housing participants leave programs for something other than permanent housing. And so what we're really looking for is how can we make sure that we're using our resources to effectively move people to permanent housing. So I mentioned before that we've been collecting data from a number of communities where we've conducted our performance improvement clinics. And so in the next 3 slides, I'm going to share some of this data. So this first slide shows aggregate data for families exiting different systems for permanent housing in 14 different communities across the country. And I want to say that we use data from communities that had really been collecting, had pretty clean data, had a lot of good data on all of their providers, all of their emergency shelter providers, all of their transitional housing providers, and rapid rehousing. So these graphs represent not just one provider in a community, but rather all of the different providers of these services in the communities. I also want to say that this data, these communities represent a variety of geographic areas, some high housing cost urban areas. We've included some rural areas, balance of states, and both large and small continuums. So let's look at this data on this first slide. This is the number of exits to permanent housing from persons and households with children from the different systems. And so what we found when we put the aggregate data together, that only 32% of families are exiting the shelter system to permanent housing. And when we looked at transitional housing, on average, only 55% of households were exiting transitional housing for permanent housing. And then when we looked at rapid rehousing, we found that 85% of households were exiting to permanent housing. And sometimes the question comes up about, okay, well, when are you measuring the rapid rehousing? Is it when they're first placed in housing? In fact, this is the measurement when people are exiting the rapid rehousing program. So when the financial assistance is over, the case management is over, and the household is being closed to program services. At the point of exit where they're no longer getting any assistance, 85% of those households are still in permanent housing when the subsidy and the case management services end. And so again, what we saw is that there's a higher amount of exits to permanent housing for rapid rehousing. The other thing I want to share is that for DHCD-funded programs in the state of Virginia, in fact, the rate of exit, the average rate of exit from transitional housing to permanent housing is 47%. So actually in Virginia, from those programs funded through DHCD funding, it's actually less than this average that we had. This slide then, next slide, contains aggregate data from 7 different communities on the rates of return to homelessness within 12 months of exiting programs to permanent housing from each of the systems in the community. And if you look at this slide, on the left side, you're going to see data on singles. I'm going to focus on data in families with children, since one of the things that we're really focusing on in the state of Virginia is really looking at rapid rehousing for families and what happens with families. So when we look at that, again, the blue graph is shelter, the red graph is transitional housing, and the green graph is rapid rehousing for families. And so we found that out of the 32% of households that exited shelter within a year, for a permanent housing exit within a year, 11% of those families were coming back into the shelter system. And this doesn't mean they were coming back to the exact same program, but we measure this from, are they coming back into the shelter system at any point of entry into the shelter system? We discovered that 9% of families that had exited for permanent housing from transitional housing programs were coming back. And then what we discovered is that when we looked at the rapid rehousing, we had higher rates of exits to permanent housing, and we had less recidivism back to the shelter system. And then this next slide is this reviews the aggregate costs for each system. And again, I want to say that each community reported information on all of their programs, all of their emergency shelter, their transitional housing, and rapid rehousing programs for exits in a year, and then all the permanent housing exits. And then the way we got this is we got them to report each program's total budget. And the total budget would include the operational costs, the supportive service costs, administrative costs for each program. And so then we divided out the total exits into the total program costs, the aggregate costs for all emergency shelter programs for families, all transitional housing programs for families, and rapid rehousing for families. And then we got those first costs. So when we looked at all exits, and again remembering that more than half of the people are exiting emergency shelter in a year, not to permanent housing, and again, the same thing with rapid rehousing, 45% did not exit to permanent housing. So what we did is this was for everyone that left the program in a year. When we looked at the cost per household that left, you can see that it was about $2,700 for emergency shelter cost per exit, a little over $10,000 for transitional housing for families, and only $3,000 for rapid rehousing. But then more significant was when we looked at the cost for permanent housing exits, because ultimately that's the goal of every program in our system. Every system that we have should be about ending homelessness and moving people to permanent housing. And so when we looked then at the cost of emergency shelter exits, it went up to $10,000 per exit. When we looked at transitional housing exits, it went up to $22,000 per exit. So there was significant increases from both of those systems. But again, then when we looked at permanent housing exits with rapid rehousing, we saw just a slight increase in cost. It was only about $1,000 more. So the other thing, when you look at the cost of a successful exit from rapid rehousing versus the cost of a successful exit from transitional housing, you can see that we could in essence, with the amount of money that we're putting into transitional housing systems, we could assist up to 5 times more households with rapid rehousing. So again, I talked before about increasing the capacity. And that's a really important thing in our systems. So again, what we saw this data indicating is that rapid rehousing models are effective in exiting persons to permanent housing. They're cost efficient, and for families, they have lower rates of recidivism than transitional housing programs. So in addition to the cost effectiveness that we showed from the previous data slides, another key reason to consider retooling is to look at the Hearth performance indicators to determine how your transitional housing program is faring under the respective indicators, and then how your indicators are contributing to your continuum of care, your system's performance outcomes. In essence, what is your project's impact in your community meeting these goals? And what I'm going to say about these objectives is that about 2 weeks ago, I had the opportunity to be in a workshop that was being presented by a HUD representative, and she emphasized several times during her presentation 2 key things. One is that everyone, every provider in communities should know what the Hearth objectives are, not just the planning people, but the community, because under Hearth, what we're doing is looking at how we work as a system. So these objectives are not specific to individual programs, but rather to everyone in the system, both funded, HUD-funded programs and non-HUD-funded programs. So as a system, we have to work together to make these things happen. And the second thing she emphasized, and she said, if you don't remember anything else, it's about your performance. We're going to be looking at individual performance, but we're going to be looking at your system's performance. So ultimately, the Hearth objectives are reducing the number of people who become homeless, reducing length of homelessness. You've heard me talk about that already, reducing the rates of return to homelessness, increasing jobs and income, other accomplishments on reducing homelessness, and thoroughness in reaching homeless populations. And the reason that that is part of it is that there was some concern that if we're going to try to reduce, look at our systems number and showing reduced length of stay and returns to homelessness, that maybe what we would do is screen out the highest barrier people and those that have the most needs. And so we have to show that we're actually serving everybody, high barrier households as well as low barrier households, and making these things happen. And so retooling transitional housing within your community has significant impact on reducing the number of people who become homeless, reducing these lengths of stays, and reducing returns to homelessness, particularly if we start focusing on rapid rehousing models. So back to the question. why should we retool? Ultimately, it's really critical that all programs are contributing towards these performance objectives. And retooling really provides an opportunity for you as a provider to take a close look at your programs and really strategically assess its effectiveness in response to these larger indicators and these larger performance objectives. Transitional housing programs have a lot of rich resources that can really be used to reduce homelessness, and it's critical for your program to look at those resources and think about how you might use those more effectively. So thinking about this, it really provides an opportunity for you as a provider to strategically assess your effectiveness and, again, meeting each of these goals. So when you start looking at your program and thinking about your outcomes, start really lining it up with these hard objectives and thinking about how are we really moving forward with this. And then retooling can really help you align with the federal plan, the Opening Doors Plan, which you should familiarize yourself with if you already haven't, which has really 10 key objectives that are national objectives to end homelessness in 10 years. And one of those objectives is retooling the crisis response system, which is really how we're looking at transitional housing and why we're thinking of retooling transitional housing. How can we retool and use our transitional housing resources to really retool that crisis response system? And we also know that communities had a lot of success with HPRP, and now that funding is gone and there's not those resources that are going to come in to replace all of HPRP. So retooling programs provides an opportunity to really build on the successes with HPRP and those rapid rehousing program successes. The other thing is that the needs in your community are constantly changing, the needs of your households, the needs of folks experiencing homelessness. And so sometimes we start a program and we sort of get stuck in what our program does, and we don't really look at what's happening in our community. And so you want to remain responsive to the emerging needs for housing and services in community, and really look at what we have. Some of you may have heard me say this before, that most of us didn't do a real good study of our communities to say, okay, back in the 80s when most programs were developed, we didn't come up with a needs assessment to say we need, this many emergency shelter beds for families, we need this many transitional housing beds, this is what it needs to look like. It was more sort of in response to maybe a crisis or our mission of our organization or our own sort of personal journey and mission that we were on, that a lot of programs started all for very good reasons, but now we really need to look at what does our community system look like and how can we retool our program to really meet the needs of our system. And then when you're retooling and looking at your program, it's really going to strengthen your performance of your project and your local continuum of care, whether or not you get federal funding. It's about us all working together as a system. So anytime we can retool our programs to strengthen our performance and strengthen our community, it's a really good thing. So while the focus of this webinar is on retooling transitional housing program to rapid rehousing, I'm actually going to talk a little bit about some other options and things that you can be thinking about. So first, we know that not all programs are ready for a complete model change, but one of the things you can do is you can begin looking at parts of your program that you can retool to increase your effectiveness and move you closer to a rapid rehousing model. For example, the HUD goal is that episodes of homelessness are 30 days or less. So earlier I talked about the fact that most transitional housing programs length of stay is at minimum 4 months and often up to 2 years. So one of the things that most programs can do to move more closely to the HEARTH objectives in a rapid rehousing model are to adopt a shorter length of stay. And one of the other things that you can do is move to a voluntary service model. If you attended our rapid rehousing trainings in Virginia, we talked about the key things in a rapid rehousing model, and so voluntary service models are one of those things, and you can start actually implementing that in your transitional housing model. So reducing the length of stay itself will increase the capacity of a program. So I'm going to, some examples of shortening the length of stay. One of the things, I'm going to make this simple, so I can do the math on this. But say, for example, you have a program that serves 10 families in transitional housing, and your length of stay is on average 365 days. So you could initially start out by saying, okay, every year we're going to reduce that length of stay by 10%. So if in the first year you take every family and you're going to reduce the length of stay by 10%, you'd be reducing the length of stay for each family by 36 days. And if you're serving 10 families, that's going to give you 360 days. So in essence, now you're going to be able to serve 11 families because the fact that you've reduced each family's length of stay, you're increasing your capacity now by 10%. So while you're reducing your length of stay, you're increasing your capacity. So as simple as a 10% decrease, which is doable for everyone, and simply just retooling your program to that option, communicating that, and the other thing is then if you're going to make those changes, you need to communicate that at the front door and really become much more housing focused so that in essence when people come into your program, your focus is on what are we going to do housing focused to help you leave here as quickly as possible. Often when people come into our transitional housing programs, we spend a lot of time talking about how you can stay in our program successfully, how to be successfully in this program. So it really is more about how you can leave successfully as quickly as possible. Another example, if you're a 10-family program and a small program that you can significantly increase your capacity, if you're a one-year model and you make a decision, we're going to shorten our length of stay to 6 months. Now, in essence, you've doubled your capacity because if every household's length of stay is 6 months, now you're going to be looking at being able to serve 20 households. And so when folks are in the emergency shelter system and they can't get housed immediately from emergency shelter, at least what you're going to be able to do is take more households and move them through so that, again, it increases our crisis response system. One of the other things you can do here that I'm showing you is your target population. We often know that a lot of transitional housing programs had a lot of eligibility requirements, and what we've heard from communities that have retooled their programs, specifically communities that were doing a lot of rapid rehousing, they discovered that a lot of the households they were serving in their transitional housing programs before rapid rehousing no longer needed transitional housing. They were able to come in that front door and get rapidly rehoused without needing any transitional housing, and they were being rapidly rehoused very quickly. And so programs started targeting the high barrier households, those households that have high housing barriers. Again, remembering the training we did on rapid rehousing, and you do the housing barrier, those folks that have a lot of evictions and have a poor employment history and have other issues that are barriers to housing that they may not be able to be housed quite as quickly, you may want to change your target population and start serving those households. And then for those of you who are actually ready to move to a new model, we are suggesting that there are, in essence, 3 things that a system should have, and that is you need emergency crisis housing for those immediate crises where if someone doesn't have a place to go that night, they're going to be sleeping in the streets in a place not meant for human habitation. A good system needs rapid rehousing, and a good system needs permanent supportive housing. So while we look at these strategies, what we also want to say is that we believe that for families, what we're finding is that in essence, most retooling should be for rapid rehousing and permanent supportive housing because in fact, we find that when we increase rapid rehousing strategies in community, we actually do not need additional emergency housing. So we're suggesting that you look at retooling to either rapid rehousing or permanent supportive housing. So how do you think about what options you should choose? So we're suggesting that there's really a 2-part analysis that you should conduct, and we've created this matrix to help you think through and evaluate your program and options. And you have to do both of these, and so sometimes people get caught up in one and not the other. So I'm going to say that it's not that this comes first and the other one comes second. You can decide which way you do it because they're both critical. So part 1 is the analysis of key program features, and so on the left side of the slide, you're going to see the housing type that you may have, and then across the top are the types of services that you may provide. And so For example, on the left side, you're going to see it says structure of your transitional housing units. So if you own or lease your facility, but it's dormitory style, then you can see what we're suggesting with that. If you own or lease your building and it's an apartment style building, and then, or if you have scattered site or leased apartments or do transition in place. So you can see those are the different types of housing. So probably already in your mind you can say, okay, this is where we fit. Or perhaps you may actually have more than one model, and so that you could sort of think about retooling different parts of your program to different models. And then when you come across a type, we have the types of services provided in transitional housing. Again, I want to emphasize this is specific to serving families with children. If, in fact, we have some people on the call that are doing transitional housing just for singles, we actually have a different chart for singles, but we were focusing more on families for this call. So we would be able to, later on, please, email me, and we would be able to get you some information on how to think about the singles. But specific now to families, when you think about the services that, a lot of transitional housing programs have employment skills, a lot of life skills, looking at economics, budgeting, housing locations, sort of those self-sufficiency skills that we talk about. And so that would be the first thing, and you can come down through and see that we're suggesting that rapid rehousing is a model you should look at for all of those types of programs. Moderate treatment services, domestic violence, more intensive employment services. We're suggesting, again, that rapid rehousing can work for all of those models. If, however, your program is really providing very intensive, deep services, you're serving those chronically homeless families, those families with a lot of high barriers, severe mental health issues, unresolved substance abuse issues, and you either own or lease your building, or you do scattered site or leased apartments, we're suggesting that permanent supportive housing would be where you should look at. Now, I want to talk about that bar across the top where it says create a rapid rehousing program, but utilize the building for other purposes. So we're actually seeing that there's some communities that are really looking at this. The reason we're suggesting this is that, in essence, for families, a dormitory-style facility really does not work to do anything other than really thinking about reuse of the building. It's not the best way for families to be successful. We're finding that, in essence, other styles work much better. So for example, we're working with a community right now that what they did, they were a site-based, had 4 actual facilities that they owned, and they moved to a rapid rehousing model, and what they've done is they've transferred those buildings to a supportive service or a supportive housing program, a permanent supportive housing program, and that program is going to use that building to increase permanent supportive housing, and then they're taking their entire operation and supportive service program budget to become a rapid rehousing model. So now let's look at the other part 2. The second part to determining the model you choose is this analysis of your community's need. So it's really critical to complete both of these analyses, as I said before, for retooling. For example, if you have sufficient permanent supportive housing in your community, then it doesn't make sense. Even though your model looks like it could quickly go to that, if you're finding that you don't have families that are experiencing chronic homelessness or are not being served, if you're not finding that you have a lot of unsheltered, chronically homeless families on the streets, then it doesn't make sense to increase permanent supportive housing. On the other hand, what we're finding is that most communities really believe that there is more rapid rehousing. So, here's the indicator that your community needs more rapid rehousing. So there's long homeless episodes. Most homeless people are not receiving rapid rehousing. So if your community fits into that, then rapid rehousing is obviously a good strategy. So it's really important, though, as you do this, that you engage, and not you on your own make this analysis, but that you engage with your continuum of care planning. Whoever is responsible for your community planning, you want to be talking with them about determining the community need. You want to be talking with them. And so, again, we're going to say that one of the most important reasons to retool to rapid rehousing is that most communities do not have enough rapid rehousing programs and have actually long lengths of stay. So by really thinking about totally retooling your transitional housing program to a rapid rehousing model, it's going to really offer a great opportunity for you to be part of this new strategy, that you're going to increase the rapid rehousing resources in your community, and you're going to really help your community meet these goals of reducing the length of homelessness. So, once you've done this initial overview of what your options are, there's really some key steps that you should take in your retooling process. So in some ways, this first section that I've gone to is sort of for some of you early thinkers in this, and this next section is for those of you that are really ready to maybe move or are in the process but not sure that you're covering all your bases. We're going to talk about some of the more technical issues and what's going to be included on our checklist. So, there's really 3 phases that you want to think about when you start looking at your retooling process. So first of all, the first phase is an assessment of your current program and planning for your new model. And then once you know what your new model is going to be, there's the phase of really getting your strategy ready for implementation. It's not enough just to say, okay, we've evaluated our program and this is what we need to do, that it really does take some time now to figure out all the details to really be ready for your point of implementation. And then the third phase is you've got to just get moving and start doing it. So making sufficient changes to your program, I want to say, takes a lot of time, and we really recommend you give yourself sufficient planning time to ensure that you have a successful transition to a retooled model. Whether it's a complete new model or you're shifting components of your program, you really want to think through this and give yourself time so you have a good transition. So we really suggest you map out a minimum of a 6-month planning process and up to as much as 9 months. We know some programs that sort of say, well, you know, we're ready to do this and we want to do this, and then discovered that in fact they hadn't thought through some things and then had to sort of back up. So if you do your planning in a well thought out process, it's going to really make the transition much better. So we're going to talk about phase 1, the assessment, planning, and preparation phase, and we suggest this should take 30 to 60 days. So the very first thing that you want to do is meet with your local continuum of care planning committee, whether it's your, you know, however you recognize that in your community. This is not just about continuum of care HUD funding. It's about your systems planning, whether you have a local coalition. I know a lot of you have really strong leadership and coalitions in your community, so that's who you want to meet with. And it's really critical that your retooling is in alignment with your systems, tenure planning, you know, what your systems program and plan is for your community. For example, as I mentioned before, if your community doesn't need additional permanent supportive housing beds and you were thinking of doing that, it's really important to be talking to your community planning committee to find out really what you want and what they need, and see where you're on board, and really get a lot of support from them for the changes you make. Each continuum of care, which is really your system, your local planning system, should be doing an analysis of their current system and the configuration of services, and they should be already identifying what's needed, so you want to make sure you're part of that process. So then once you've met with that local planning committee, the local coalition, you want to develop a retooling committee, a specific committee, and task them with this whole assessment and planning process. And so we suggest that you have about 5 to 7 members. When it gets too large, the efficiency goes away, but it's really critical that you have key members. And so we're suggesting that obviously the executive director of the program would be involved. You want to identify 1 or 2 key board members who are really influential and really understand the process of change, that can also assist in getting the board on board, play on words there, and get them invested in the process. You also want to have 1 or 2 key staff people that are currently in the program. Again, who are the people in the program that are really going to have a lot of influence that you want to bring along that can help with the transition with the rest of the staff? You want to identify 1 or 2 major funders that, again, are those, who is funding your program, who are people that really support your program, and have them be part of the planning process. And then we recommend that you have a community representative, a continuum of care representative to be part of this planning committee. And so then next, once you have your committee, so the real task for this committee is then to assess and evaluate the current program, and that's the work that you're going to want the committee to do. So this is going to include assessing and evaluating your current data, establishing some baseline data. So what you want to do is include information on what populations you're currently serving, how long participants stay in the program, your number of exits to permanent housing, the length of time between the program entry and the exit to permanent housing. So not just you want to look at the average length of stay for all participants in the program, regardless of where they go, but then you also want to look at what happens, what's the length of time with people that come into the program and exit to permanent housing, and are there any differences in those demographics. And you also want to look at your cost effectiveness. Go through what I talked about on our cost effectiveness chart, sort of what is our capacity, and really be I encourage you not to look at just your past year data, but maybe the past 2 or 3 years. Have there been any trends? Are you seeing anything happen? And all of that is going to be really critical as you look forward to your next step and what you want to do in your next program. So also part of this phase 1 then, the 4th thing that you would do once you've assessed your current data and you've evaluated the strengths and weaknesses of your program, then you want to identify the potential model that you're going to use for retooling. So again, the model can include rapid rehousing, permanent supportive housing, or it can be to make some significant policy changes regarding your targeted population, your length of stay, and the voluntary services for those of you who are not ready to retool to a complete new model. And as you identify the best model, you want to take into consideration your area of expertise, your target populations, what's going to be the needed staffing configuration, what do we currently have in our skill sets, what are we going to need, what changes are we going to need to make, also who's going to need to manage the change, who's going to be responsible for sort of to drive the train and get everybody on board with the train as it leaves the station, new and different partnerships that you need. So if you've done all of your services internally and had a really rich supportive service environment, as you move to a rapid rehousing model, and services are going to be post-placement. If you recall, it's home-based services and leveraging a lot of community services. One of the things you're going to want to do is think about the new and different partnerships that are needed, and also think about merging options. In some communities, 2 or 3 smaller programs came together, and then it really increased their resources and their skill sets and their levels, and they were able to merge into a larger program. So think about that as well. This would be the time when you're identifying the model that the committee should start really using that decision matrix that I showed earlier and start really assessing where you fall on all of those issues. So then once you've identified the model, one of the really important things is to really start thinking about what are some barriers and things that we need to, solutions that we need to have for those barriers and some strategies for those barriers. So you want to assess, again, the level of commitment or the potential resistance from key stakeholders, including your staff, your board, your funders, any other stakeholders. If you have significant donors that are really vested in your program, what are some barriers, what you might need to do to strategize to overcome those barriers. Even for the consumers in your community, we all know that consumers sort of get a sense often what's on the streets matters more than what we're saying. So how do you get the buy-in and get the word out that you're really shifting your model and that, again, if you've been a one-year program and people sort of come in and say, well, I don't have to think about housing right away. I can stay here for a year and work on some other stuff, and now you're going to be a rapid rehousing model. Obviously, people that you're going to work with are going to really have to change how they think about your program as well. So, you know, the issues that you want to be addressed are going to include what about our funding sources, any barriers there that we're going to have to identify and work with, and around funding, are there going to be some contract revisions, how are we going to get community buy-in, and then back to this building use, and what we're going to do to think about our building use. So I'm also going to suggest that sometimes you might want to consider and compare, you know, sort of two options on how you're going to do rapid rehousing, so that, you know, you may sort of start down one road, or maybe you've decided and it's been permanent supportive housing, but as you're working towards it, you see that that may not work and you decide you want to switch to a rapid rehousing model. So have some options so that as you look at potential barriers, if there's some really significant roadblocks with some funding and some building issues, that you can still move forward in retooling, in essence, move to Plan B. And then the next thing is really important to develop a communication strategy. So once you know what you want to implement, the committee really needs to develop a plan to communicate this retooling plan with targeted stakeholders. Again, the continuum of care leadership. Even if you have you know, someone from your continuum of care on your board, how are you going to get it to the overarching leadership? Local politicians, funders, board, staff, local government. Really think about who you want to communicate this to, because good communication is going to be really key to reducing the barriers and moving the process forward once you get to the implementation stage. And then at the end of this 30 to 60-day planning stage, you need to have a very clear final recommendation. And so it's going to say, here's our, you know, here's the committee's going to say, this is our recommendation, this is our retooling model, and then a plan of implementation, which should include a rollout schedule. And again, you want to make sure that this is communicated so that folks in your community, and your staff, your board, are prepared for the changes that are coming. So then the next phase is the implementation and planning phase, and we suggest this takes about 4 to 6 months. And so the first thing that you want to do that's really critical is to identify your new vision and core values to shift the organizational culture. So you want to identify the vision that's really going to drive the retooling process and the adoption of the new model. And again, I can't emphasize this enough, having it written out, and just every time you talk about this, you start out by saying, here's our vision for our new model, here's the core values, and that really is going to drive everything else that you're doing in your implementation process. You want to develop an organizational structure for this new model and have a program flow chart so people can really see what you're looking at. And then you want to identify what aspects of the current organization culture that will need to shift in order to adopt this new philosophy. For example, if you've sort of had the housing readiness approach where, you know, you've had phases and people have to go through certain program steps and phases to become ready for housing before they can be moved to permanent housing, and now you're moving to a rapid rehousing model, that's a huge organization cultural shift. You know, I talked about that paradigm shift from the front door, that sense of urgency now. So how are you going to have to shift that organizational culture and be prepared to do that? So again, having a clear vision and communicating those core values is really going to set the stage for all areas of implementation planning. Here's what I want to say, where the other, that first phase is sort of step-by-step. You know, you do step 1, step 2, step 3. This, actually, you need to be working on all of these things simultaneously and really thinking through your implementation time. How are we going to work on all of these things? So the next thing on your checklist is going to be, here it comes, identifying your staffing and training needs. So you need to revise your job descriptions that will need to match this new vision and model. What skills do staff need? What are going to be their new core responsibilities? And get them very clear in writing and start showing them to your staff. You also really need to have ongoing communication and training for your staff. What are we going to have to train in? You know, where are we going to shift in terms of what the roles and responsibilities are? You want to allow opportunities for open dialogue, but that open dialogue is more about the shift and the concerns, not about whether the shift's going to happen and whether the new program is going to happen, but a matter of how you're going to prepare and implement for that program. And there can be staff turnover. You may find as you shift that you have a different skill set, that people that are there are not going, may not want to do the new job and may choose to leave. We have also found that some programs that Retooled actually found that when they were no longer a site-based program, they didn't need the number of staffing, and so it meant shifting people. And this was the one particular organization I'm thinking of that actually did some other things besides transitional housing, so they were able to shift some of their staff positions to another role in the organization. You also want to clearly update your policies and procedures. Policies and procedures, think about what you need to change to meet this new vision and core values, and I can't say enough. Good written policies and procedures really to emulate the new model are key to an effective transition, both internally and externally, and having really clear written policies and procedures are not only going to help your staff in implementing the new program, it's really going to help your residents when they come in, your participants in the program, to really know what they need to do. I think I missed one. Okay, and then you want to obtain board support and endorsement. So you're really going to want to identify who is on your board that supports this retooling and how you can engage them and getting the rest of the board engaged. So you also might want to bring in your planning folks from your coalition and have them do some real education. I also suggest that you even now start really educating your board on some of these new things that you're hearing about. Put together short PowerPoint presentations for each board meeting to sort of educate your board on the changes that are coming with Hearth, the changes in your system, this real focus on rapidly rehousing families, what does it mean, so that as you're retooling, this is not a surprise to the board and they're going to really know what's happening. Also, if the board realizes they're part of this larger community and they're going to be really part of moving the community to a whole new perspective, that's a really exciting opportunity for an organization. So the more you can engage them and have people come in and present at your board meetings, that's going to be really helpful. So you also now want to create clear outcomes measurements and benchmarks that you want to achieve, and you want to align those benchmarks with your community goals. For example, when I was working in the Lancaster County, Pennsylvania community a number of years ago, one of the things that we as a continuum did for all transitional housing providers as part of our 10-year planning process was we set a community-wide goal that all transitional housing programs would exit 85% of their households to permanent housing within 6 months. And so that was our community-wide target. So then, and then every program started looking at what changes they needed to make to start measuring those outcomes and achieve those benchmarks. So if your community has something similar to that, it's not just about your own internal outcomes and benchmarks, but aligning with making sure you're on board with where the community is headed. And so then you want to review them at least quarterly and get some baseline data and communicate these results to funders, to staff, and board. And you also are going to want to readjust and adapt with any changes that might be needed to look at your outcomes. You may find that you sort of started one place and that you're seeing something's not working. So you really use those benchmarks and those quarterly reviews to know that you're where you need to be. Two things popped up. So we're going to talk about developing a proposed budget and identifying your funding issues. So you want to actually develop the proposed budget for this new model, look where funding can be shifted from one line item to another, and also identify any funding constraints. So, what are the current funding sources that you have? What may need to be modified? I apologize if you hear a siren in the background. This is Washington, D.C., and we tend to have a lot of sirens in the background. Okay, so back to what I was saying. You really need to know what your funding sources are. What, are there some constraints? Were you funded to do a particular thing that you may not be able to stop doing immediately, or you may need to talk to that funder? If you're HUD funded, you need to contact the field office regarding any contract amendments that may be necessary. If you're looking at completely retooling from a transitional housing model to a rapid rehousing model, you need to talk with them about the reallocation process and how that would work. You need to identify any new sources of funding that can support the new model. By moving to a rapid rehousing model, this may really open up the door for some new opportunities for funding that you didn't have in the past. And then you want to identify your points of contact for each funding source and then be able to communicate the revised budget with them or know who you need to talk to as you move on forward on this. You also want to be identifying your spectrum of community partnerships throughout this. What collaborations and outside resources are you going to need to support households in their independent housing for a rapid rehousing model? And really focus on external service provision instead of internal service provision. So who's already providing those services in the community, and then what are our draft models of agreements going to look like? Are we going to have memorandums of understandings, MOUs? Are we going to have just linkage agreements, or are we actually going to have some subcontracts and then start developing them with the partners? Again, you don't want to wait till you're ready to implement to do this. This is why you need to be working on this, and we say take a good 4 to 6 months to get all of this stuff ready to go. And then you want to, again, develop a clear communication plan as it goes on. So this is internal communication to the board and staff on regular updates and external communication to the community and funders. People need to hear the message with the target dates and expected changes and have a real clear message. If the message doesn't come from you, there will still be a message out there, and so you want to make sure that you're driving the communication and driving the message. And we've heard that from a lot of the providers at Retool. Make sure you're driving the message. I'm sorry, I'm going to go back. It switched a little bit too much. So, important thing, building use. So you really need to take steps to alter building use if necessary, particularly if you own your building or if you lease your building, it won't be as difficult unless you have a long-term lease. But if you own your building, you're going to have to really look at it. So, you may have some funding constraints, but start looking at new uses, and options could include, using it in your new model, or selling the property and using the proceeds for operating expense, or again, other utilization. Is there something else that the building could be used for something in your community? And then you need to explore and resolve any funding constraints that would prohibit selling or reuse of the building. I would again suggest in some of these steps as you go to funders or you're looking at building use, really engage your community planning group of folks, because they can really often open the doors for you to have these discussions. And you also then want to resolve any local code issues regarding any building reuse. And so then the last stage, and this is starting the shift. So you just need to have a start date and say this is when we're going to start and be communicating with that, but then have a contingency plan if things don't go quite as you expect. Be able to sort of step back and regroup, and again, communicate this implementation date with a larger community. And then I want to say that the determination of the start date really can depend on funding and contract dates, so you do need to look at your funding cycle, and you may also need to sort of phase in the startup date, so think about that. But I am going to say it's really important, however, to just sort of get going sometimes and then tweak along the way as you shift to full implementation. So now I'm going to turn it over to Ross from Hilliard House, and she's going to talk a little bit about, from her perspective, how this retooling worked for her. Ross?
Thanks, Kay. Again, this is Ross Altenbaugh. I'm the Executive Director with Hilliard House. And I just wanted to give you a little background about who we are and what we've done in the past. And I think I always had hoped that when we were sort of making our initial shift about a year ago, that I had heard a little bit more from local folks on how they were doing this shift. And so I'm delighted to be here to share a little bit about what we did. And we're still a work in progress, but hopefully I can help this move along for you. Hilliard House started as a transitional shelter about 12 years ago and operated as transitional shelter up until about a year ago. We started, when I started at Hilliard House as the executive director, the writing was really already on the wall about sort of the direction the pendulum was swinging and the way that the funding was headed and that kind of thing. So I sort of walked into, you need to look at your model and how effective it is in your community. And so right off the bat, really felt like I really needed to start having conversations in my community about what we needed and where Hilliard House would fit into that whole continuum. And so I think that my initial indication was that I needed to understand for myself what the research was. I mean, I certainly had heard it from my continuum. I had heard it from the Alliance. I had heard it from the Coalition. And I really heard everything. I'd seen the matrix. I had seen sort of all the material that was out there, but I really needed to understand for myself why this was a good shift for my agency and how we could be a part of a larger solution for family homelessness in our continuum. And so I did the research myself. I, sort of went out and did the reading, and I think I had my aha moment, and so I felt like I could sort of organically talk to my board and the funders and our, community partners and staff and all the way down to volunteers and then, of course, our clients with a sort of real sense of this is the direction we should be headed, not because someone was telling us we needed to, but because it was really the right thing for us. And so I encourage you as you go about making decisions for your agency and your community that you really are having that moment for yourself and really understanding what is best for your mission and your community, because I think that without that it's going to be hard to create buy-in within the folks that support what you do. For me, I really needed to go out and then take that education to first my board of directors and try to do that education with them so they really understood the options. So I would recommend, taking, like Kay said, some of the matrix and some of the sort of planning assessment tools to those people and having them be a part of, is this right for us? Because then they can really help create your message in the community and to the folks that help to get your work done. So from a mini retreat that we had where I could really explain the options to my board in November 2011, my board adopted this rapid rehousing phase. And for us, it was about saying that on January 1st of 2012, we were not going to bring families into Hilliard House with the expectation that they could stay for a year. And that really sort of cemented the process. Over the last, I guess it's been, 9 or 10 months now, we have really been in the heavy transition phase of it. I think that the tool, the checklist that Kay has shown is really a helpful one, and it mirrors kind of the path that we were on. I wish we had it when we had started, because it really, the points are really there. I think that some just brief challenges that we came about as we sort of went through this process. Of course, funding continues to be our biggest challenge. I wish I had really specific answers for you about how to navigate through HUD and all of that kind of stuff. I just don't. We're still in conversations with our lead agency and with HUD, trying to figure out how we can go about, utilizing our facility space and making what we have work and that kind of stuff. I will tell you that, in Richmond, we're lucky to have a really organized community, I believe, and we've got the centralized intake, we've got the uniform housing barrier assessment that we worked really hard to, organize and put together over the course of the last year, and so sticking with your continuum and your lead agency, I think is really important. Having the conversations, although they're not always easy, talking about what your community needs and being able to really be transparent about what you're doing and what you need, I think is critical to trying to move forward for the good of the system. And so once you've kind of gotten through that, some of the challenges that I've experienced really are around the stuff that I didn't think about. So following what Kay mentioned in terms of having your physical plan written out for the what-ifs, I think is really important. One of the things we encountered was making sure that we had really strong messaging to our clients We had a communications committee developed specifically around messaging for staff and for volunteers and for donors and for our community, and making sure that we got our message out. But we didn't necessarily focus on we focused on policies and procedures for clients, but not necessarily what the message was about who we were and what we were trying to do. And I think that there are pieces to that really we can spend a lot of time around voluntary services for our clients and doing some of the right things. But if we're not really being upfront and honest right away about how long they can stay and what our mission is and how we're trying to move them forward, I think there are areas that you can get caught up in. So I encourage you to have conversations with your staff around making sure that you really are saying the same message across the board. Something else I would share is just that I think as an executive director, working with board and community partners, sometimes you can get in your head about having to move everybody at the same time. I think I often thought that there would be a point in time where there would be sort of a gun that would go off in the air. It would be like, okay, ready, set, go. And that never happened. It really just sort of started once the transition, once the motion was in play, we were able to kind of tackle things as they came. So I encourage you to not stay in your own head with your board and some of the upper level thinkers. I encourage you to really reach down and get your staff's input once they have buy-in to your change. I think that it can be isolating for those folks to try to be doing what you're hoping for them to do without really pulling them up with you and showing them kind of what needs to be done. So I would encourage you to have real focus around that. And it seems like in other agencies within at least the Richmond community that there's been a lot of that, and I think that it's really important. One of the other things I would say is that if you can try and just really stay flexible with what the possibilities could be. I think that for instance, we were able to leverage some community support and community dollars by having a collaborative with 2 other agencies in our community to hire a housing specialist. And that has been something, while we are just in the infant stages of having that position filled, I think it's going to be something that is going to help streamline some of the process in our community for some of the agencies that are just getting started with this. And so being able to collaborate with your other partner agencies, I think, is really important as everybody's sort of taking steps towards this new process. So what I would say is just keep after it, and don't get frustrated when things don't seem to work out, because I think it can be a really challenging thing to change what an organization's mission is, and I think that there are times where it can get really scary. But I think you just have to stay after it, and don't be afraid to ask. Don't be afraid to ask your community and the resources that we have available, because they're the ones that are going to help you get there. So I hope this was helpful. I think I'm going to send it back to Kay so she can tell you a little bit more about some of the other opportunities. So thank you.
So thanks, Ross. And as I'm sitting here listening, I wrote down 3 key things that I think are really important. And so, one of the things that she talked about was the messaging for clients, and I know I touched on this just a little bit, but I can't emphasize that enough, is that if you're, again, what the community has sort of gotten used to for your program, particularly at the client level, when you're making a shift, you really need to help the folks that you're serving understand understand the new changes, what the program's about, and that takes a lot of time to do that. Ross also talked about working with a larger continuum several times, the larger planning, and having that support and being part of the larger systems change is really, really critical. And so, you want to be communicating and doing a lot of education and communication with your own board of directors, but you also want to be constantly doing the same thing with the larger continuum of care, coalition planning board, and leadership. And I think this collaborative that Ross talked about here at the very end, and while it's not a full merger that I had mentioned that you could possibly do, anytime organizations can come together and think strategically and collaboratively and pool resources, it just really creates a lot more opportunity, makes us a lot more efficient, and all of this is about the folks in our community that we're serving. And I think it's a really great idea when we think about that and do that. So thank you so much, Ross. Great points. So I want to talk a little bit about funding opportunities to retool. So and again, I'm going to say that we have stuff up here about HUD funding, and I'm going to share some stuff that we've gotten directly from some folks at HUD. But what I'm going to say is we are not experts in the HUD grants, and neither Phyllis or I will be able to answer any of those questions, but we're just going to give you some stuff that we do know to help you think through this a little bit. So the first thing I'm going to talk about is continuum of care funds. And this slide comes directly, if you look down here, Laura Rout, she's the Deputy Director in HUD's Office of Special Needs Assistance Programs, and this slide comes directly from a presentation she did. So there's something that I'm going to talk about reallocation and how you can think about reallocation. But before I talk specifically about reallocation, that's specifically for currently funded transitional housing projects under continuum of care funds. But I want to say, and we should all know this, but I want to make sure is that rapid rehousing is now an eligible permanent housing option. So when, one of the things that housing bonus has historically been able to be used for is just permanent housing, which would only be permanent supportive housing. So now permanent housing still includes permanent supportive housing, but it includes rapid rehousing. So if you currently are a transitional housing program but you don't receive continuum of care funding, you could potentially develop your retooling model to rapid rehousing and be working with your local continuum of care planning committee to find out about the submission process for a new permanent housing project under rapid rehousing. So it's an option to really be thinking about. And again, going back to what Ross said, that constant communication with the lead agencies in your community, with your planning folks, is going to be critical. So even letting them know that you're interested in doing that and finding out what would need to happen to come in as a new project is going to be important. But this slide now is about reallocation. If you are currently a transitional housing program and you want to retool to become a permanent housing project as rapid rehousing or permanent supportive housing, this would be if you're shifting your funds in part or in whole from one or more expiring renewal projects to create a new permanent supportive housing or rapid rehousing program or project, then this has to happen before the competition submission deadline or after new grant. So that would mean like now, because the competition submission deadline isn't happening yet, so you'd have to really work very quickly on doing this, or after the new grant agreements have been executed. So when all the new grant agreements that would come in under the submission would be executed, but again before the next competition. However, the interesting thing that came from Laura is that new projects created through this process are funded under selection criteria for renewals. So again, what I'm going to say is that, I don't understand exactly how that works. I really believe that when the NOFA comes out, the Notice of Funding Availability for Continuum of Care Funding, which we expect should be out by mid to late October, there will be more direction on this reallocation process. But again, if you're interested in doing it, don't wait till that happens. Start talking to your folks now. Start even maybe shooting an email off to your field rep. I'm not sure if they're in that sort of frozen time where they can't give you information, but they might be able to give you specific logistic information. But again, communicate this. Start the process of talking now. Don't wait to find out what it means. At least start asking the questions. You can also send any question to the the help desk through the HUD HRE website to ask any question around that. So there's two ways to look at retooling according to Laura. One is this reallocation where you're actually, no longer going to be considered a transitional housing project, but a permanent housing project under rapid rehousing or permanent supportive housing. The other way is repurposing. So it's when you look at your current transitional housing and the way you currently are serving and what your current contract says, and you're going to repurpose it. So you're modifying your existing program to increase your capacity or effectiveness. And so this just requires an amendment to a grant agreement, and it can actually be completed anytime during the year. Again, this would be through your field rep, so this does not go through a major allocation change, but these are some of the things that Laura had on her slide, some examples of program design changes. And if you think about it, back to that first slide that I talked about, how to retool when you start retooling some components of your program. So if in fact, you've got a 2-year program or an 18-month program, one of the things that would just could be done under a simple grant amendment process is changing your length of stay or changing your target population. If you've been serving certain people with low barriers or a certain population and you're going to change that, that would be the kind of thing through a grant amendment. And so again, if the number of persons you serve, if you're changing your length of stay, you should shorten it. You should certainly be increasing your capacity, and perhaps even if you're a transition in place program, it may allow you to increase your capacity if you're giving a shorter term subsidy in terms of the number of units that you can provide. Here's the one thing I'm going to say. If you're currently a transitional housing program and a transition in place program, if you tweak the model to look more like rapid rehousing, in essence, transition in place and rapid rehousing are the same thing as long as all services are voluntary, and it's a short to medium-term rental assistance instead of a long-term rental assistance. So, really be thinking, or financial assistance, so really be thinking if you're currently a transition in place, what things do we need to just tweak in our policies and procedures to, and then your funding would not necessarily have to change, and you would start really looking a lot more like a rapid rehousing program. So again, any information about that needs to go to the HUD help desk. So I took this information from a fact sheet on the new emergency solutions grants, and these are now emergency solutions grant eligible activities, rapid rehousing activities, including the cost of housing relocation, short and medium-term rental assistance, and housing stabilization services. So monies can be used for, a housing locator, it can be used for the financial assistance, and then that follow-up case management housing stabilization services are eligible activities. But specific to Virginia, back to the slide. So DHCD funding opportunities for rapid rehousing. So effective July 1st of 2012, transitional housing is not eligible for state ESG funding, the non-entitlement areas administered through DHCD, so that just took place a couple of months ago. And DHCD will be releasing their application for the statewide emergency solutions grants in late winter, early spring of 2013. Again, eligible activities will include funding for rapid rehousing. So if you're looking at moving to a rapid rehousing approach, then look at the timeline, think about the the funding and where your funding is, and think about how you can apply for rapid rehousing funding under that specific format. So I also want to say that not specific to DHCD, but under just the emergency solutions grants, HUD was very, very specific and very clear in all of their training that they really wanted to emphasize rapid rehousing. They saw it to be a much better use of funding because we know those folks are already homeless, and they, a lot of their literature said that it was more difficult to figure out how to target prevention resources to people who would become homeless. But with rapid rehousing, we know that we're definitely impacting homelessness in communities because those folks are already in the homeless system. So, in final, in closing, sort of what I want to say is that regardless of where you are in the retooling process for your transitional housing program, again, whether you're just starting to think about it or whether you're well on your way to making significant changes, it really is important to regularly assess and evaluate your program. You should be, on a regular basis, measuring your effectiveness in meeting these HEARTH objectives and, again, your local community goals, and being part of the larger community planning process in reducing and ending homelessness. So here are some resources that you can use to help guide you through your evaluation and retooling process. At the top of the screen, I put our website, and the first 3 tools are on our website. So the first resource is a manual on creating organizational change, and it really provides some good samples for some tools of things I talked about earlier, like sample job descriptions, sample memorandums of understanding, and again, as Ross was saying, that she wishes she would have had the checklist. And I remember when I worked on retooling a program, a transitional housing program way back in the mid-2000s, and then I saw this manual when it came out a number of years later. I was going, oh my gosh, if I'd had this, it would have made life so much easier. So I really suggest, if this is on our website, you can download it, so take a look at it. We also have a 2-page resource just to talk about how rapid rehousing can be used to successfully end family homelessness. So it's a tool that you could use particularly in training your staff or in training your board on the direction you're headed. And then the Alliance also published the Rapid Rehousing Creating Programs That Work manual back in 2009. One of the things I will say is that that was for when HPRP first came out. We've learned a lot through HPRP, and so we haven't updated that manual, but I think, again, sort of looking at the key components of rapid rehousing, it still gives a lot of great tools. So I am going to say that coming soon, I talked about the fact that we're going to release a toolkit that's going to have the matrix and the checklist and some community examples. So keep your eyes out for the release date. We will announce the release of that toolkit through our newsletter, our blog posts. If you are not, a fan of us on Facebook, you can go to our website. On the first page, you're able to sign up to our newsletters, and every week you get announcements of tools that the Alliance is releasing. It's a really good way to stay on top of those things. We also anticipate that on the HUD HRE, Homeless Resource Exchange website, that they'll be releasing some training specific to some of the reallocation processes that I talked about earlier. And so I'm going to turn this over to Phyllis. I think the one thing I'm going to say is I know we shared a lot of information today, and I also want you to know this has taken a lot of time and energy to begin this process of retooling. And I want to say that, shifting transitional housing to a rapid rehousing isn't necessarily, a complete change of intervention. It's more a shift in the way you're going to target and deliver your services. So if you start thinking about that, you've got great services in your program. So how do we just start retargeting them and shifting them to the rapid rehousing model? So I'm going to turn this over to Phyllis now for summary and questions.
Great. Thanks so much to both Kay and Ross for all of that information. We're now going to have an opportunity for you to ask questions and for those questions to be answered. A reminder that if you do want to ask a question, you are muted, so we can't hear you, so you do have to type your question into the box that appears on the right side of your screen. Another reminder that the webinar is being recorded, and you can find a copy of the recording along with all the slides that were shared on our website, www.vceh.org, and that will be available in several days. There were a number of questions with regard to how household exit to permanent housing is being defined. Kay, you shared a number of slides earlier, so can you talk about how is exit being defined?
Okay, so I think exits from emergency shelter and transitional housing, that's specifically, again, when somebody exits an emergency shelter bed and moves to permanent housing and you enter in that exit date into your HMIS system, and you would say that where their destination is. So on the rapid rehousing side, again, what we are looking at is at that exit date from the program. Financial assistance is ending. The case management is ending. It's when you would go in and close the case to services. So the households may, depends how long you provide financial assistance for. Most programs that we looked at, the majority were 3 to 6 months of financial assistance. Some actually provided a longer-term financial assistance. In some cases, financial assistance ended, but case management services continued for another 2 or 3 months. But nobody was exited from the program as long as services were there. So, for example, if you were a rapid rehousing program, or the same as with any other program, when you enter in that person's exit date and their destination from the program, they're now close to services, the program will not be providing any services. That's the exit date that was on there. In terms of then the recidivism, we looked at their exit date. Again, not the time they moved to permanent housing, but we looked at the exit date, and looked at the recidivism rate back into the system. And so if, for example, somebody in rapid rehousing was placed in permanent housing in June, but they did not exit until December, and they exited into permanent housing in December, they have no more financial subsidy, they have no more case management services. We would look 1 year later from December to December to see if they've come back into the homeless system again, not from the date they were placed in housing, but the date they were exited from the program. So I hope that clarifies that a little bit more.
Thanks, Kay. Let me ask a related question. So, and you can clarify that this is accurate. So your answer to that question was that the household is no longer receiving financial assistance or services. Is that correct?
That's correct. They are no longer receiving any services. They're closed. The case is closed. They're being, exited. You're closing their file. You're closing them, as a closed case now, and they're no longer receiving any services.
Okay, so just to clarify then, they're not receiving any services through the program that was providing them with the rapid rehousing assistance, but they may in fact be receiving services from another agency in the community?
Sure. I mean, that's part of rapid rehousing, is to engage them in a larger whole, but it means that they're no longer in the program. And so, and again, when we looked at the cost of the program, we looked just at the services that were being provided by the program. If you're, connecting them with another case manager, which is what we want to be doing with other community services, obviously those organizations still have that case open, but it's specifically to the rapid rehousing program ending, not providing any more financial assistance, not providing any services. Let me also say, and this is not on a slide, but in the clinics, the majority of households served exited without a subsidy. So they got the short-term financial assistance, but then when their case was closed, they were not in subsidized housing. I think what we saw, about 95% of folks were exiting to non-subsidized housing. So there was no longer financial assistance. I think sometimes people saw rapid rehousing as a bridge to a long-term subsidy, but in most of the communities that we did the clinic in, very few of those communities used it that way, and in fact, very few communities had any long-term subsidies. So there was no subsidy happening after people were exiting the program. For 95% of the people exited.
Great, thank you. The next question is, how do you define self-sufficiency in rapid rehousing programs, and what's the goal related to self-sufficiency?
So I think that ultimately, and this is sort of a difficult one, and again, when we did the training, in Virginia on rapid rehousing. We really talked about the goal of the financial subsidy, that it was not about alleviating poverty, and it was not seen as, the whole idea of a long-term subsidy, but rather a short-term. It was about ending homelessness. And so the way rapid rehousing defines the success in a program, we suggest you measure outcomes, and let me say, we didn't mention this earlier, is that this is part of the recertification process, the rapid rehousing recertification that every provider in Virginia learned about, and so some data and information was set out, and we've actually sort of outlined some of these questions. So rather than going into a lot of detail right now, I would suggest that you maybe take a look at those materials. You can request them from us, and we'll get them to you. But we outlined what would be the outcomes and what would be the suggested outcomes to measure success in a rapid rehousing program. So there's different targets you look at. You look at those that exit into permanent housing. You look at those that are still in that housing 6 months later. But not everybody stays in the same housing that they're going into. I mean, people move a lot. I move, not anymore, but I used to move a lot. And so, because I decided that, maybe it didn't work, but ultimately this is about ending the homelessness and moving people out of the homeless system. So we know that people are going to be moved out through rapid rehousing, and many, many people are moved out in rapid rehousing, and so they're going to be paying a lot more than 30% of their income towards maintaining their housing. But it's individualized for what each household needs to sort of maintain their housing, in what levels they need to do, what services they need to leverage to be able to maintain their housing. So it's more about housing sustainability. Instead of using the term self-sufficiency, we use the term that they're going to be able to sustain their housing and not end up in the homeless system again.
Thanks. The next question is for either or Kay and Ross, and the question is, what have been the most common barriers around funding that are tied to particular programs, and how have they been addressed, if you're able to talk about that? But the question is, what are the most common issues around funding?
So I can start, and then Ross, you can talk maybe specific to your program, because I think that would be helpful, because I'm going to talk in general kinds of things. So I think that one of the biggest constraints around funding has been for folks that have a long-term lease on a building. So if they're a site-based and they've been leasing a building and they're locked into a 10-year lease, then that's going to take a lot of talking and negotiating, and can sometimes get in the way. Or I think I mentioned this a little bit before, is if you own your building and you're under some of those long-term contractual agreements that the building has to be used. If it was, you got HUD funding, whether it's through continuum of care money or other local HUD dollars, there's a lot of contractual use that the building has to be used for a particular period of time. And so what we've learned in some programs is that perhaps they've had, they started with one site and then they added, and so they're at different stages of where they are in some of that, so that they're able to actually, they're not under any obligation for certain sites, but they are for others, so they start moving on the sites they are. And I would say one of the other big funding issues that comes up is with private donors. There was one particular program that had one particular donor that really invested a lot of dollars into a site-based program. In fact, the whole project was named after that donor, and put a lot of seed money into it. And so to now make the change, what that meant is that they had to really do a lot of work with that particular donor and their family to really talk about why they were doing this. So, engaging those individual people who have a real passion and compassion for what you've done. And, we've really sold our programs really well to our private donor base, why our transitional housing is so important, why we needed to do it the way we've done. And then suddenly we come back with maybe a completely different model, and we're sort of saying, okay, well, now we've decided that's not the best way and we're doing it this way. You're going to have to really communicate well, and you may lose a few people, but you may actually gain some people too. So you have to look at both sides of it. And I think then the other thing is how you look at your budget and shifting things from line items. say, for example, that you got some funding from a local funder, United Way, to do a specific task, maybe life skills classes in your transitional housing program, and now you're moving to a rapid rehousing model and you aren't going to be doing that, and yet that's part of your budget that pays for some of your overhead costs or whatever else it does, then that can be particularly tricky. Since you were funded for that specific activity, that may be one of the constraints that you're going to have to do a lot of work with those funders and think about, can you get them to agree to shift that money to some other area of your budget, or in fact, could you stand to lose that funding? So Ross, do you want to talk a little bit about some of your specific funding issues?
Sure. I would say, I actually agree with a lot of what you're saying, Kay, and I would say in terms of the budgeting piece and programming, for us it was about sort of shifting our mind frame to be thinking about how could we continue to maybe deliver that service just in a different way to clients. So if it's something that you feel like is a really effective part of your program in transitional, maybe it's something that while you still have that funding, you can still do that kind of work just when they're in their own home, and then look at other ways to leverage other resources in your community going forward, so you might be able to do without that funding and maybe get those services to that client in a different way. I would say that from a personal standpoint, I would go after really just, again, having that buy-in and understanding and really believing in what sort of you're trying to do is going to just really clean up your message to your funders about what you're trying to do. I mean, I think people hold on. I was one of them. To kind of the specifics of why your program works. I mean, we had 83 to 85% of our clients going into permanent housing from transitional housing. So to hear, that this wasn't the best way, I think was, certainly hard to hear. And I think it was hard to hear for our funders and our volunteers and the people that really believed in what we were doing. And so I think it was a matter of really talking to them about, like, yes, we're still going to do this same great service, but we're just going to do it on the backside. We're just going to get them into their own housing because we know that they'll have, just as good of, a situation in their own housing, and we can take away this time of homelessness that they experience by doing it this way. So I do think that it's a little bit of a mind shift. I do think that it certainly doesn't always work, because I think that there are folks that are just, certainly going to sit on the other side of the fence of this conversation all the time. And so I think it's about being able to have conversations. And, the good news is that while it might close some doors to certain funders, I think it has often opened new doors to new funders, so that we couldn't have gone after before. So, just trying to craft our message differently and, in an exciting way has been, certainly something we've spent a lot of time focusing around.
Thanks. The next question is, can rapid rehousing programs be shelters? And in the first few slides that you shared, Kay, when you were comparing shelter versus transitional housing versus rapid rehousing, is some of that rapid rehousing being provided in an emergency shelter?
So that's a really good question. I think that what we found in most communities, the majority of rapid rehousing programs were like standalone programs, but there were certainly some organizations that had a piece of what they did that was rapid rehousing and was one of the strategies within the shelter. So certainly rapid rehousing can be a component or a service within an organization, and then can move people in that direction. But then when you think about your funding, in some ways, then what the funding for the rapid rehousing piece of the program will probably be different than some of the funding around the emergency shelter. And I would say, in terms of where rapid rehousing should be, if it's going to be like a site-based part of another program, is if it can be at that front door, which is your emergency shelter, to move people out more quickly, that's really the key way to do it. So what I suggest then is that in transitional housing, so if you're not going to move to a complete rapid rehousing model, where, and the rapid rehousing model has those specific things. People have their, are in their own housing, they have their own leases, voluntary-based services, leveraging the community services, and a short-term financial subsidy. So that's what a rapid rehousing program looks like. But a transitional housing provider can certainly adapt their program to a rapid rehousing focused model, or in essence what we used to call is a housing first model. So starting to really shift that everything that we recommend every transitional and emergency shelter housing provider should be focused on is quickly housing people. But if we're going to do it as rapid rehousing, the goal is the minute somebody hits the door, let's try to get them to the next level. One of the things in a community that's really sort of taking this to the whole next level is Columbus, Ohio. I'm not going to speak at length, but certainly you could reach out to the community shelter board there to find out a little bit more about what they're doing. And so they only have an emergency shelter, and they're moving everybody from the emergency shelter, this is on the family side, into an apartment within 45 days, but all the apartments, all of what used to be traditional, transitional housing has moved into these different sort of levels of subsidies. So people are in their own housing, but they move and they get a subsidy, a different, like maybe just a 2-month subsidy with 2 months of services, or then other people may get a little bit longer subsidy and services, so that they sort of have tiers. But that's how they really took all of what used to be called transitional housing, and everything is in essence sort of that transition in place model. So in essence, all transitional housing is now rapid rehousing. And so that was where they made the big shift. And then it's all connected, but they have like those people in the emergency shelter system, sort of the housing barrier piece, and the staff there are really doing that barrier assessment and getting folks moved into the appropriate model that they need to. So that's a really good way of starting to look at it. That would take a complete community change to work at that. So that's not going into a lot of detail, but again, I would suggest if you want to know, more specifics about rapid rehousing, take a look at the certification. That can give you some ideas of what it would look like if you were going to do a rapid rehousing program as sort of a separate program within a shelter. There'd be some real specific things that you would need to do. It also needs to be focused on moving people out quickly. So, again, it's not the kind of thing of, well, people are here, and once they're here for a year, now we're going to give them to the rapid rehousing. The concept of what a rapid rehousing program is that when people hit the shelter system, the door, they're referred to the rapid rehousing program. So it's not like, okay, now they've completed their length of stay and they're timing out. And under HPRP, that was one of the things people talked about as an eligibility, people timing out of transitional housing. But to really move to a rapid rehousing model, it's not about timing out. It's about starting from the day they hit the system. Does that help?
Yes, thank you. The next question is with regard to funders. And the question is, if we want to modify our contracts, how do we do that in a way that doesn't make it seem like we didn't know what we were doing in the first place? And Ross touched on this a bit. So, Kay, if you want to start, then Ross, you can jump in and add.
So I think obviously it depends where your funders are in the system and what funders you're talking about. Obviously, if you're going with HUD and modifying a contract, I mean, ultimately, HUD used to tell us this is what we needed to do, and it was about transitional housing, and HUD has learned through best practices and changing the paradigm that it needs to be done. So you would probably run into that with if you're talking federal or state dollars, because clearly this is the direction it's headed. So it depends in your community and who your major funders are. I would expect that communities that are well organized have brought in the funders and should be bringing in the funders, and there should be these funders collaboratives that are really being sort of educated around this move. And so, you know, if you're talking major funders like United Way funders or, you know, local government funders, my expectation is that hopefully they'll have gotten some education around the direction that this is headed. And so, you know, but if in case that, you know, if that's not the case and you feel like people are still in the old models, then I think you just take the best practices. We learn from what we do. And we've learned, you know, and HPRP gave us the opportunity. You know, in the past, we had dollars, you know, and we were funded to do emergency shelter, and we were funded to do transitional housing, and then funded to do a little bit of permanent supportive housing. There really was not funding to do rapid rehousing, and there were just some programs across the country that were picking some of this up. And then, you know, we started hearing about housing first, but it tended to be, again, sort of focused on, you know, deeper permanent supportive housing and really not so much the rapid rehousing model. And so this came from communities that just started doing some stuff differently and figuring it out. You know, my own local community, we had a program called Sheltered Independent Living back in 1988 before anybody was talking housing first or rapid rehousing, just because as a community we had just sort of recognized that it was important to help people move out of shelters and into permanent housing. And so we were doing something similar, but I will say that even that program, as rapid rehousing, you know, came out with financial subsidies and some of the stuff, that program continues to have to change the way it did business because we know more about even how to do this than we used to know. I mean, we used to require that everybody had to have, you know, a certain months of sobriety to be housed. Well, we don't do that anymore. Again, I'm not there anymore. The program doesn't look at that because that's not the rapid rehousing model. So we've learned this by people trying new things. So I think if you're going to talk to a funder that's not familiar with this, as I would just, again, you know, I talked about some of the resources about how rapid rehousing works for families. Look at our website, you know, get your background. And talk about how we learned through HPRP. You know, over $1 billion was pumped into the community to allow us to try something that we had never, most communities, very few communities had the opportunity to try before. And guess what? It worked. Like, it worked really, really well, and that's the data that I showed you. And so what we know today is based on trying something, and so we keep learning. And that's the way learning is everywhere. We keep learning to get better. My hand's moving here. You can't see that happening. But, you know, we keep having to grow and get better. So I think I would use that as your baseline. And, again, it's about educating folks. It's not that what you did before was bad or wrong. It's just that now we've learned some stuff that's even better. So we're taking what was a good program or great program, and we're making it even better. Ross, do you have anything you'd like to add to that?
No, I think you said it great.
Okay, great.
Great. The next question is with regard to the data that you shared, Kay, around the effectiveness of rapid rehousing and the rate of return to homelessness. In terms of the data that's available, is the impact of rapid rehousing consistent even if you're talking about a community where the cost of housing is very high?
So the answer to that is, in fact, yes. It is consistent. And let me give you the example. Data that was included in this particular data is from Alameda County, California, where their cost, that's the Bay Area, if you're not familiar where Alameda is in California. And in fact, their data is what really sort of we started really looking at because it was just so significant. I looked up the other week their fair market rent for a 2-bedroom unit, which is almost $1,400 for a 2-bedroom unit in their community. So, so if we want to look at cost of living, that's a really high cost of living. In rapid rehousing, they were one that I sort of used that target, that 95% of the people exited the program without a subsidy. They also served high barrier people successfully, so it wasn't, they opened it up and they had the basically same success rate with high barrier people. I think the only difference with high barrier people is at 93%. They had the same rate of exit to permanent housing, but 93% exited without a subsidy, so just a couple more people in the high barrier got a long-term subsidy, probably like a permanent supportive housing voucher because they had such high barriers. And their average amount of assistance, including the case management services and the financial subsidy, was $2,400. And in fact, the average length of time for almost 70%, the subsidy was about 3 months. So what we learned from that, and what they learned from that, is that people figure this stuff out when given the opportunity. People want to be in housing and just need sometimes that hurdle to get sort of out that front door of the shelter system, because once you're in the shelter system, sometimes it's really hard to exit the shelter system. And so by giving that opportunity, people started figuring it out. What I will say in high-cost areas is that you have to be really creative with what the permanent housing looks like, and I think sometimes we get hung up on that every family has to have their own lease because, families should never be in second tenancy, but we've discovered in high-cost communities that most poor families never become homeless in high-cost communities. When we look at the numbers of, I just did this for a particular community. It's a fairly high-cost community in Pennsylvania, suburbs of Philadelphia, and that when we looked at it, people that lived below the number of households, they had 40,000 households that lived below the poverty or below 30% of median income in their community in 2010, and yet less than 1% of those households ever became homeless. And so most poor households are able to make it, and a lot of the ways they make it is by having shared tenancy or living with other family members, and sometimes that can be a really good thing. Obviously not if it's an unsafe situation or severely overcrowded, but sometimes rapid rehousing is about helping folks access a support system they already have, and once they're connected with their support system, they're able to make it. So I think that it's a combination. I think we sort of get hung up that people should only pay 30% of their income towards their housing, and that poor people don't do that. In fact, here in D.C., not poor people, people who have significant income still pay way more than 30% of their income towards housing. So we're not suggesting that people need, that the folks are going to be able to do that and pay just a little bit, be able to maintain their housing in high-cost communities, in, high-cost two-bedroom apartments. But again, even at fair market rent's based on a line, I think it's 40% of housing in the community is less than the fair market rent, so you're going to want to look at the housing that comes in under fair market rent, and you're going to want to be really creative and be realistic in what folks can afford and what might work for them for permanency. Remember, in many of our shelters, particularly emergency shelters, but even a lot of our transitional housing, it is co-tenancy. People are living in small spaces, and learning to manage with people that they're not connected with, other than just living in an environment where, I know that I ran a transitional housing program one time where we had 5 families sharing one kitchen. They each had their own quarters, but they had to share a kitchen, and it was amazing how well they figured it out. And so I think that's what we need to remember, is that our folks are really resilient. So yes, that data does include high-cost areas. I probably gave more information than you asked for.
No, that was great. The next question will be our last, given the time that we have left. So the last question is, with regard to a transition in place model, other than having the lease in the client's name from the beginning, what are the major modifications that need to be made for a program to be defined as transition in place?
So I think, well, I mean, you can be transition in place. However, to make it a rapid rehousing model, the lease is in the client's name, it's a short-term rental subsidy, and the subsidy is not based on the client's meeting mandatory service participation. So, if a client, if you go out, it's not about, in essence, kicking people out of the program or ending financial assistance because we said that you have to do A, B, C, and D, and you have to have mandatory services. You need to participate in certain life skills classes, because even a lot of transition in place programs still had certain mandatory participation requirements in order to get the rental assistance. So to move to a rapid rehousing model, you want it's short-term rental assistance that that you would just probably start out with just 3 months would be a recommendation, and then you take a look at that and assess where they are at the end of 3 months, and we find that most families can do it within 3 months, and it's a voluntary home-based service model. So those would be probably the key components of what you would be looking at. And so the biggest shift we find in traditional transition in place models is that there was the mandatory service component or the subsidy would end. And so we would suggest that the subsidy is not contingent on service participation, but the subsidy is contingent upon lease adherence, and the lease should look like anyone else's lease. A lease needs to look like the same lease that you and I would have if we'd be renting an apartment, so there's not written in some additional requirements. And as long as people abide by the general tenancy, they pay their rent on time, their portion of their rent on time, they're the good neighbor, they're doing what they need to do with property care, and they're abiding by the they're not moving in a bunch of people that aren't on the lease without notifying the landlord. As long as they're within the terms of the lease, they would be part of the program. So it's just that not pushing the mandatory services and mandatory participation in things.
Great. Thanks so much to both Kay and Ross for the great information that was provided today. This webinar is part of an initiative that's a partnership between the National Alliance to End Homelessness, the Virginia Coalition to End Homelessness, the Commonwealth of Virginia, and the Freddie Mac Foundation. There are, of course, going to be additional questions that you have with regard in particular to how to use HUD funds to either reallocate or repurpose, and just more questions as you decide to undergo this shift and as you're figuring out how to make it happen. Through this initiative, which is focused on shifting to rapid rehousing, there is assistance available. So please ask for help, and you can ask for help by either emailing me directly, Phyllis, Phyllis, @vceh.org, or by emailing Anna Blasco, ABLASCO, @naeh.org. A reminder that if you do have questions for HUD, that once the application becomes available, they will no longer be able to answer your questions, and at this point, they might not be able to answer questions either. So if you have questions that pertain to your HUD funding, you should contact HUD through the HUD HRE Help Desk. And if you have questions with regard to DHCD funding, the information that Kay provided was provided by Kathy Robertson at DHCD. So any questions with regard to the use of their funding should be directed directly to them. So thanks again to everyone for participating on this call, and good luck as you decide how you want to more effectively use your transitional housing. Thanks.